again, everyone. This is your host for today, Dr. Ardith Tan, on episode 7 of MedChat, your health questions answered. Ang MedChat ulit ay ang munting public service ng De La Salle University Medical Center ukol sa mga kondisyon at katanungang medikal. Our aim is to provide you with expert opinion on specific conditions that could be a problem for you, your loved ones, or your friends. Our featured topic today is very timely, and it's how to address the stress brought on by the pandemic. I'm pretty sure that because we've been in this situation for more than a year now, that a lot of people have been affected in many ways. Our featured expert completed Doctor of Medicine at the De La Salle Medical and Health Sciences Institute, College of Medicine. He did postgraduate internship at Manila Doctors Hospital, and he completed his training in residency in adult psychiatry at the V. Luna Medical Center, Armed Forces of the Philippines Health Service Command. He is currently a medical consultant at the Department of Psychiatry of the De La Salle University Medical Center, and he is an assistant professor at the De La Salle Medical and Health Sciences Institute College of Medicine. He is a Medical Officer 3 at the Department of Mental Health and Behavioral Sciences, V. Luna Medical Center, and at the Assistant Resident Training Officer at the Department of Mental Health and Behavioral Sciences. Ladies and gentlemen, please join me in welcoming Dr. Raymon Joseph Valdez, who will talk about coping mechanisms during the COVID-19 pandemic. Dr. Valdez, welcome. Kamusta na kayo?
Yes, mabuti naman po, Doktor. Ayun po. So I'm glad to be invited to have this talk. So the title of my lecture, as you can see now, is Coping Strategies During the COVID-19 Pandemic. This lecture was originally made by Dr. Iris Franco Bartolabac Ariola, who is the one and only psychiatrist in Masbate. And I just made additional notes to this lecture. So actually, Doctor, I've already given this lecture to several government agencies. So what is the COVID-19 situation right now? So unfortunately, this situation that we are in, we are forced to stay at home. There were loss of jobs, social isolations brought about by the quarantine. What else? Coping mechanisms, like for example, kung sanay tayo na we want to go out or gumimik or out of the country, yun. So it's already scarce. So yung ating travel is very limited. Person-to-person interaction is reduced, especially as Filipinos, we like to handshake, we like to beso-beso or hugs. So it's being prohibited now due to the social and physical distancing. What else? Of course, we have lost loved ones during this time, or if for COVID or non-COVID causes, of course, we are not allowed to, let's say, go to funerals because of the situation. We also witnessed some of our colleagues get COVID. Yun nga, like what I said earlier, yung mga newly graduates, loss of opportunities, especially those who are in the tourism industry, hardship of getting jobs, education was put on hold. If I'm not mistaken, I have one patient who stopped schooling because of the COVID-19, because of the anxiety. Nag-stop siya mag-aral. And literally, yung mundo natin ay nabaliktad siya. So it was put upside down. So yun nga, unfortunately, when we were unable to see friends, we see friends virtually. So later we will talk about that. Unable to travel or have a vacation, yun nga po, di ba, yung mga gusto mag-travel, yung mag-beach, bawal na or mahirap. Actually, Doctor, nung time na there was a lockdown, I was in Thailand that time. Nung nag-announce ng lockdown si President Duterte, I was in Thailand having my vacation. So I had to cut down my vacation para makabalik ako kagad sa Pilipinas. Yon, social coping strategies are not available like eating out or nightlife. Yan, bawal kasi. So all of us were forced to cope at home, and some of us are home alone. So adjustment to work from home and online school setup. So ako po, I had a hard time because I'm also a professor in 2 other medical schools, or well, 3 medical schools including Lasal. So I had to adjust also from yung work from home, and we had to do mga webinars yan. So yung mga mothers na nag-work at home, nagkaroon din, or parents na nag-work at home or work from home, there were increased child caring burden. So nadoble yung kanilang trabaho. Of course, ito yung nagkaroon din ng xenophobia, yan, political impacts. Xenophobia, di ba, nagkaroon po ng mga discrimination among Asians, there were conspiracy theories, and there were social unrest. And social inequality became more pronounced, like yung mga mas makaka-afford magpa-hospitalize, mas madali silang madala sa hospital. Yung iba, medyo hirap. Of course, because we are a very religious country, or we are a Christian country, there's also a religious impact. We're unable to attend church services or activities. So ang daming mga na-put on hold. And of course, ito yung malaking impact sa ating lahat, the psychological impact. So the real pandemic now is the mental health pandemic. So ano ba yung dapat nating gawin? Acknowledge your feelings. Ito yung isa sa mga pinakasikat na Korean novela na sikat last year. So ito yung sinasabi natin na it's okay to not be okay. Yan. So acknowledge mo yung feelings. Kailangan mong tanggapin, or kailangan mong isipin na totoo yung nararamdaman mo. So your feelings are valid. Yung pagiging malungkot or pagiging kabado, this is not a sign of weakness. Okay lang magalit, okay lang mapagod, and okay lang din magpahinga if you need to take a rest. Tandaan natin na hindi tayo nag-iisa. So marami tayong mga nakakaramdam din ito. And there are a lot of things that we can do to cope. You can reach out to other people. Ito yung natin yung silver lining. Mamaya silver lining, pag-usapan din natin yan. Ito yung silver lining ng virtual We can talk to each other virtually. Like one time I had a talk with my friends. One was in Dubai, one was in Washington. So, di ba, if we all have this technology and we can easily talk to our friends. And then it's okay to talk about your feelings. Do not be afraid to talk about your feelings. If you feel sad, if you feel anxious about what's happening, it's okay to talk about it. And you are the foremost important person. Yan, ikaw, tayo, yung sarili mo ang pinaka-importanting person. So, what are the healthy coping strategies? Learn self-compassion. So mahalin mo yung sarili mo for you to be able to love others. Practice self-care. So take long baths, or kunyari kung let's say now open ang mga nail spa, mga nail salon. So pedicure, manicure, or have a hair spa. So open na naman siya ngayon. Do personal or physical decluttering. I did that last year. Unfortunately, cluttered na ulit yung aking bedroom. So, actually, Doctor, the reason why unconsciously I cluttered again my room, for me not to be able to sleep in my room, I made my room like a mini office. So if I'm in my office, if I'm in my room, that means I'm working. So bawal akong guluhin, parang ganun. You should also do mind decluttering. So do social media detox. Wag ka muna mag Facebook, wag ka muna mag Twitter para ma-clear yung mind mo. Do also peer decluttering. Personally speaking, I had one friend na we were not seeing each other regarding about the pandemic. So what I did was I asked him to, parang nagkaroon kami ng break sa Facebook. So parang hindi ko na, parang I unfollowed him, or there is a thing in Facebook that you need to take a break from your friend. Then after 2 weeks, parang okay na ulit. Yun. So we talk again after 2 weeks. Avoid information overload. What does this mean? Get reliable information from reputable news sources. So avoid sharing fake news. So for example, like me, before I share news, titignan ko muna, I double check if this is reliable or totoo ba to. Or sometimes what I did actually up to until now, since last year, I seldom post COVID-related news sa Facebook page ko. Kasi ang thinking ko po, Doktor, doon is I don't want to see this after so many years. Kasi this pandemic is really depressing to all of us eh. So ako, ayun yung naisip ko na I don't want to see my post, mga COVID-related post after a year or so, or after 2 years, or after 3 years. Kasi may ganun si Facebook eh. Bumabalik yung mga pinopost mo. So ako, sa akin, noong una, I post regularly about COVID, yung mga COVID-related news. Tapos naisip ko, ayoko ng ganito, ayoko siyang balikan. So I deleted the COVID-related post that I did last year. So up to until now, I seldom do, or I do not post COVID-related news sa aking Facebook page. Avoid reading into the future much. Meaning, wag yung ano kaya pwedeng mangyari bukas? Paano kung may ganitong mangyari? Ang i-focus natin dapat kung ano yung pwede nating gawin today, yung now. Kasi yun yung important. A little anxiety or worry will help us keep guarded. Konti lang. Kasi being depressed or being anxious or maging kabado ka is okay. Pero when this anxiety or depression or feelings of sadness takes over your everyday life, then that's a problem. So a little worry, okay yun. Kasi makakapag-prepare ka. Pero yun nga, reading too much to the future to the point na hindi ka na makapag-prepare kung anong pwede mong gawin today is bad. So, importante kung ano yung pwede mong gawin right now. Do not isolate. So, let's say you're physically isolated. You have your cell phone, you have your laptops, then you're not isolated at all. Reach out and seek help. Reach out to your friends, reach out to your relatives, seek help. There are so many avenues kung saan pwedeng humingi ng tulong. Ayan. What else? Yung healthy coping strategies natin. Do sleep hygiene. What is sleep hygiene? So, ang dami nito. Kunyari, you are used to working sa bed. Yun yung katulad ng ginawa ko. I used my room as a mini office. So, hindi ako pwedeng matulog doon. Whenever I'm there, hindi ako inaantok. So, ganun din yung dapat yung gawin. Kung hindi ka makatulog, learn, parang you need to train your mind na your bedroom is for sleep. If you want to read something, get out of bed and read the book on the table. Yan yung sinasabi ko rin sa mga patients ko na if you're fond of watching TV to make you fall asleep, no, don't do that. Because if the show or the movie or the series that you're watching is interesting, then hindi po kayo makakatulog. And have a regular exercise. Pero wag po yung mag-exercise ako para mapagod ako kasi matutulog ako. No, hindi po yung po pwede. So, mag-exercise kayo during the day and dapat magpahinga na sa gabi. Have a proper diet. Of course, healthy diet, yung may vegetables, right amount of fat, right amount of proteins, yan. Don't consume too much alcohol. And don't cope with illegal substances, especially if you feel depressed or anxious, or sinasabi natin na iinom ako ng konting ganito para to calm my nerves. E minsan, hindi na nakakalm yung nerves, inom ka pa rin ng inom ng alcohol. Do relaxation techniques like meditation, yoga, or deep breathing exercises. So this is yung deep breathing exercises natin. So inhale through the nose, then hold for 3 seconds, then exhale slowly through the mouth. So you can do this for 10 cycles whenever you feel anxious, or when you wake up in the morning and before going to sleep. It will help you relax. Actually, may nakita po akong parang animation ng deep breathing exercises. You can look it into sa YouTube, meron pong mga ganon. You can follow the exercise. So these are the red flags on your mental health. So for example, if you're having sleep problems, so insomnia or hypersomnia. Siyempre, insomnia, yung hindi ka makatulog. Hypersomnia, yung antok ka na, tulog ka ng tulog, pero let's say you have 10 hours of sleep, pero you still feel unrefreshed. Yung parang sa tingin mo, hindi ka pa rin nakatulog ng maayos. If you feel irritable, yung isang kibot lang, irritable na. If you have incessant crying, yung iyak ka ng iyak, pero meron po akong ganitong mga patients na they feel like crying, or they are already crying, pero they don't know the reason why they are crying. And there's constant worry and being restless, yung parang hindi ka mapakali, you feel worried pero walang reason for being worried. Poor or increased appetite, yan, common din yan, yung hindi may anorexia, hindi ka makakain, or sometimes mayroon din tayong may mga clients din ako na would tell me na stress eater. So yeah. And like what I said earlier, for those who consume alcohol more, that's a red flag. Kasi ang tinatawag natin yan, they are like self-medicating with alcohol. Yan. If you have hallucinations already, like auditory hallucinations, if you feel paranoid, and of course, suicidal ideations or thoughts. And ito, malaking problem din to. Kung nangyari, because of the irritability, you have already social dysfunctions na nagkakaroon na kayo ng problem sa family or relationships with your girlfriend, boyfriend, or wife. And of course, nakalagay ito sa ating DSM-5, unable to work or poor work output, or yun nga, nagkakaroon ng dysfunctionality na. Yung ikaw, yung bilang tao, nagkakaroon ka na ng problem sa work or problem sa school, then that is a red flag. Feeling tired or fatigued all the time, yun nga po, like what I said earlier, yung ang haba-haba na ng tulog mo, pero parang pagising mo, pagod ka pa din. And ito rin, may mga clients din po ako nito. Even though they're watching a comedy show, they're not laughing anymore. So yun yung red flags. And if you have these red flags, your mental health might be compromised. And huwag po kayong matakot to seek professional help. I think yun yung isa sa mga goals ng Philippine Psychiatric Association, to take away the stigma in seeing a psychiatrist. Yan. Ito yung mga crisis hotlines natin. So we have the National Center for Mental Health Crisis Hotline. So you can call them. This I think is 24 hours, 0917-899-USAP or 8727. And the Natasha Goldborn Foundation or the Hope Hotline. So 0917-588-HOPE. So ito yung mga crisis hotlines na pwede nyo tawagan if you think you have the red flags. And kung gusto nyo, ayaw nyo ng calls, meron ding mga online psychiatric consults. So we have the Philippine Mental Health Association. I think we have one in Batangas and one in Quezon City, here in Quezon City. And we also, you can find them in Facebook. Also, the Samahang Tumataguyod sa Gawaing Pangkaisipan. or STGP, also in Facebook. STGP, Doctor, is a group of psychiatrists who practices in Batangas, Quezon, Laguna, Cavite. Yes, yun po. Kami po yung mga nagpa-practice. So, kasama po dyan sila Dr. Santos, Dr. Briguela, and other psychiatrists in Quezon and Batangas area in Laguna. And you can also go to the Philippine Psychiatric Association.org. This is the official website of the Philippine Psychiatric Association. Meron po doon, you can search for a psychiatrist if you want face-to-face. Yun. Pero yan, may mga online, maraming mga online consultations, or you can contact yun nga po, these groups to help you if you need to seek consult for a psychiatrist. So ito yung mga silver lining. Look for the silver lining of what's happening to us. Quality time with family. Kasi nga, di ba, lahat work from home, online schooling. So maganda yung quality time with the family. And we are being more self-aware, and there is more meditation time and self-improvement. For example, like what I always tell my clients, balikan natin yung dati nating hobbies or discover new hobbies. Dito pumapasok yung mga plantitas, plantitos, or yung mga mahilig magluto, or I want to learn how to play something, play an instrument, or cook, or I want to learn to bake. Yan yung mga ano. So able to gain more healthy coping strategies. Yun yung sinasabi ko with my especially suicidal patients. You turn your destructive behavior into a more productive behavior. So practice gratuity. Let us all be thankful to be alive. Ako nga po, Doktor, kahit makasakay, kunyari may tumigil lang na tricycle, kasi I'm a commuter. Kahit may tumigil lang sa akin tricycle, pagsakay ko, I always say thank you. Kasi, di ba, it's the smallest things that makes us happy. Yeah. So, in summary, this thing is what I got from this picture I got from the World Health Organization. So, it is normal to feel sad, stressed, confused, scared, or angry during this crisis. So, talking to people you trust can help. Contact your friends and family. If you must stay at home, maintain a healthy lifestyle, including proper diet, having a good sleep, do regular exercise, and social contacts with loved ones at home and by email and phone with other family and friends. Like what I said earlier, do not use smoking, alcohol, or other drugs to deal with your emotions. If you feel overwhelmed, talk to a mental health care worker, or if you're afraid to see a psychiatrist, you can go to your family physician or a counselor. Kung ayaw mo ng psychiatrist, may kilala kang guidance counselor or psychologist, or to our students, na yung medical students, meron naman tayong mga counselor, talk to them. So have a plan where to go and how to seek help for physical and mental health needs if required. Actually, sinasabi ko rin, Doktor, sa mga patients ko, yung mga natatakot pumunta, kasi I only do face-to-face. I only do face-to-face consults. I always tell my clients that the safest place in the world is the hospital. Kasi sa hospital, it's already segregated. This is COVID area, this is non-COVID area. Of course, our clinics is already safe kasi it's a non-COVID area. And we practice the social distancing or physical distancing na dapat i-practice sa clinics natin. And get the facts, gather information that will help you accurately determine your risk so that you can take reasonable precautions. So like what I said earlier, find a credible source you can trust, such as the WHO website or the Department of Health website, para malaman mo ano ba talaga ang dapat nating gawin when we get COVID or whatsoever. Limit worry and agitation by lessening the time you and your family spend watching or listening to media coverage that you perceive as upsetting. So meaning, if you don't like to hear about COVID, then might as well do not watch the news. Ako po, I do not watch the news personally because of course, even though I'm a psychiatrist, I feel rattled sometimes whenever I hear like, oh, may COVID, may ganyan. So what I watch now, news na non-COVID related as much as possible. Tapos, ito, draw on your skills you have used in the past. Yun nga po, revisit your previous hobbies that have helped you manage previous life's adversities and use those skills to help you manage your emotions during the challenging time of this outbreak. So, yun nga, instead of being destructive, make something productive. Like yun nga, taking care of plants, taking care of pets. Yan, marami pwedeng gawin. Cooking, whatsoever. Yan. So, revisit your previous hobbies. So thank you for listening to this very short lecture. So this ends my lecture for this day.
Dr. Valdez, thank you very much. That was very informative, very comprehensive. May mga katanungan lang ako. Okay? So yung unang sinasabi nyo is may mga manifestations or red flags tayo for patients na merong nagkakaroon na sila ng stress or mental health problems. Napansin ko na dun sa slide nyo, pinakita nyo muna yung mga minor manifestations. Halimbawa, sleep problems, irritability. So maaaring sa point na yun kasi hindi pa nila ma-pick up eh.
Yes.
Na those are signs of inability to cope with the stressors. Pero definitely, pag nakakaroon na kasi ng hallucinations, medyo advanced na yon. So would you advise na pag nagsisimula pa lang magkaroon ng sleep problems, yung irritability, nag-i-increase yung appetite, dun sa stage na yon magsimula lang magkonsulta ang ating mga kababayan?
Yes po, Doktor, kasi that thing is already a problem. Yun nga, di ba po yung nabanggit ko, there's already what they call yung stress eating. Yan. Problem na po yan. At saka, di ba po, for example, if we go to yung sleep problem, if we have difficulty falling asleep pagdating sa umaga, we're going to be dysfunctional kasi we're gonna be feeling tired. Hindi tayo makakapagtrabaho ng maayos. So that thing, basta once your dysfunctional or your functionality is already affected, yung sa pagtatrabaho or pag-aaral mo, affected na, that's the time na you need to seek consult na po.
Okay, but this is with the understanding na yung mga coping mechanisms or strategies ginagawa na nila.
Yes, provided po ganon. Or minsan, kasi most of us, syempre, minsan magulong-magulo na yung utak natin, we're not able to cope already. So, pag ganon, kunyari, let's say you're already doing the coping mechanisms, pero sa tingin mo, hindi pa rin okay yung iyong pakiramdam, yun, might as well seek consult na po.
Gusto ko ngayon pumunta sa social media because, social media has become an integral part of our lives,
yes.
Right? Ewan ko kung may tao, liban na lang dun sa hindi talaga nag-gadget, may mga tao na hindi sanay sa social media kasi kahit yung mga tricycle driver, yung mga tao, yung mga kasama ko sa bahay, yes. Katulong, may mga Facebook page sila at ang iba ay multiple pa yung kanilang Facebook pages. I agree with you na to a certain extent, ang paggamit ng social media ay nakakatulong kasi it helps you to connect. Pero sa mga panahon na to kasi that everybody else is posting about COVID-19. Sa totoo lang, personally, nung nagsimula yung pandemic, nakatutok ako sa social media, yung updates, pero after a while kasi parang medyo napapagod ka na eh. Parang nakakaroon ka na ng some form of fatigue. Right? So
yes.
I think tama yung advice mo na to cut. Okay? I-cut mo muna yung pag-update sa mga bagay tungkol sa COVID-19, lalo na if it's causing some form of stress, or maybe at least give yourself a break. Like ang ginagawa ko ngayon, weekends as much as possible. Unless emergency ang kailangan kong i-address, I try and keep away from my social media contacts. Okay? So those are practical advice for our fellow Filipinos. Okay. And then I guess that's the term that you call media detox.
Yes.
Kasi for my generation, sa generation mo kasi, Dr. Valdez, lumaki kayo na may social media. Sa generation ko kasi wala eh. So sa amin, it's not so much of a problem.
Lumaki din ako walang social media.
Okay.
Lumaki din ako walang social. 80s naman po ako pinanganak. Pero, well, yeah. Very true. We really need to, we really need to cut it out from time to time.
Yeah. And I think it's probably the much younger generation. Nahirap sila. Kasi sila yung lumaki dito eh. Kinalakihan nila to eh. Okay? Yes. And actually, a lot of them, parang extension na ng kanilang mga kamay, ang kanilang cellphone, na tablet, at computer. Pag nawala ng kuryente, di ba, at wala kang charger, parang dun sila nasi-stress out. Pero, tama ka, may silver linings talaga ang pandemic na to. Okay? And then,
Doctor, speaking of gadgets, ako po, I have compartmentalized my gadgets. Parang compartmentalized. For example, my laptop, I do not have Facebook in my laptop.
Okay.
But ang Facebook ko ay nasa phone. Nasa cellphone siya. I have a tablet, dun lang ako nag-YouTube. Kapag kaharap ko po ang laptop ngayon, yan, kaharap ko, it's either I'm doing a lecture, PowerPoint lecture, or recording a lecture, or doing this, webinars, or basta pag laptop po ang kaharap ko, trabaho. Pero pag pag tablet, leisure yan. Yun po yung, so compartmentalize yan. Pag basta ganun po ako. That's what I do.
Okay. Yeah, that might be good advice. Kasi sabi nga nila, dapat hiwalay mo raw kung ano yung classroom mo or work area mo from your bedroom. Pero kung hindi ganun kalaki kasi yung bahay mo, hindi mo physically magagawa yon. So yung advice nyo na i-compartmentalize at least yung gadgets nyo is very practical. It's very practical advice. Okay? So yung unang-unang way to address yung stressor is to accept, tanggapin mo muna yung feelings. Right? Yes. I think it's the same with any other problem or a loss of a significant other or a loved one. Tanggapin mo muna yung feeling and then work towards coping with the stress by strategizing.
Yes po, okay. Doctor.
Meron pa ba kayong gustong idagdag na practical para sa ating mga kababayan on how, kasi I don't think this pandemic is going to go away anytime soon. Unang-una, ang bagal lang roll in ng vaccination. Hindi pa tayo nakaka-achieve ng herd immunity. And we will, I think for a longer period of time, gagamit tayo ng virtual meetings, virtual consultations, and tama ka, Dr. Valdez, ang kultura ng Pilipino kasi we're a very social culture.
Exactly.
Okay? We may be one of the poorest countries in the world, pero we are one of the happiest people simply because we can get together over food. Sabi nga nila, kultura ng Pilipino is we eat, when we eat, doon tayo pinakamasaya kasi doon tayo nagsusocialize. And I think that will affect a lot of Filipinos, and just eating together virtually it's just not the same.
For example, yun nga, let's one of the most practical things that I can say now is if you have the gadgets, if you have a fast internet, use it to your advantage. Na kung saan you can talk to people from malayong lugar na gusto mong kausapin. For example, this is a silver lining, Doctor. We can easily discuss these things through the internet, di ba? You are in Cavite and I'm in Quezon City. So it's so easy to do these things because of the technology nowadays. Unfortunately, for some of us na walang masyadong, that's the isang reason din yan, Doctor, that's the reason why I do not do online consults. Because some of my patients, wala silang ganong technology. So you're gonna have, talagang palagi ko silang in-encourage to go to the hospital, seek consult, because the hospital is safe. Do not be afraid of the hospital. Ganun po. So yun nga, kung if you really want to go out, be extra careful. Yun talaga eh. Even if you're fully vaccinated, tiisin na natin ang face mask at face shield kung gusto mo talagang lumabas. Ako po nga, doktor, kasi I'm a very outgoing person. Before pre-pandemic, I go out every week. Pero ngayon, ang leisure time ko, grocery. Yun na po. Masaya na ako pag pupunta ako ng grocery. Kasi if you parang yun na yung, may gimmick ako sa grocery. Ibig sabihin, bibili ako ng mga essential stuff for myself. Yun na yung pinakamasayang araw sa linggo ko pag pupunta po ako ng grocery. So yun, be careful. If you wanna eat out, be careful. Yun.
In other words, I think the way to survive really is to adjust to the situation.
Yes. Because the situation will not adjust to us.
Exactly. Yeah. Okay. Any last words, Dr. Valdez, before we wrap up the session?
Yun nga po, if you have the red flags like what I discussed earlier, do not be afraid of seeing a psychiatrist. Huwag po kayo matakot sa amin. Tutulungan namin kayo. Doktor din kami. Tutulungan namin kayo. We will help you hanggang malampasan ninyo yung anxiety, yung depression. Kasi yun nga, and acknowledge your feelings. Kasi pag hindi natin in-acknowledge yun, bigla na lang tayong sasabog, or if we do not talk about our feelings, like what I always tell my clients, if you do not talk about your feelings, bigla ka na lang sasabog, magugulat na lang yung mga tao sa paligid mo. What's happening to this person? Ano bang problem? Yung pala, ang dami-daming problem, iniipon, bigla na lang ganun. Malala na pala yung problem. Do not be afraid. Huwag kayong matakot sa psychologist, huwag kayong matakot sa counselor. Huwag kayong matakot kasi we are here to help you. Yun po, Doctor.
Okay. Salamat ng marami, Dr. Valdez. I think this has been a very fruitful session and afternoon. Okay? So for our viewers, kung gusto nyo magkonsulta sa isang psychiatrist, I advise you to look at the Find Your Doctor webpage ng De La Salle University Medical Center for the specific clinic schedules and contact information. Okay? At I'm pretty sure na maraming mag-tune in, hindi lang once, baka may ibang umulit pa. Kasi I think it affects not just adults, but even kids, you know.
Yes.
Lately, ngayon lang inalaw yung mga bata na lumabas dun sa mga non-restricted areas under quarantine. Okay? I'd like to invite our viewers to like and follow the official De La Salle University Medical Center Facebook page. Visit our website at www.dlshsi.edu.ph/DLSUMC and visit our YouTube channel, DLSUMC YouTube channel. Okay? Para sa karagdagang advisories at updates ng services ng De La Salle University Medical Center. Again, reminding everyone, we're here to help you know more about what you need to know as we help you in nurturing your health, in particular, your mental health. So I'm just informing everyone na maaring sa mga susunod na episodes, we will have guest hosts from different specialties. Malay nyo, si Dr. Valdez will be one of our guest hosts at siya naman ang mag-interview ng isang expert. And they will take over my place in my absence. So mga kababayan, ito po muli si Dr. Ardith Dominguez-Tan for MedChat, your health questions answered. Until episode 8, continuing to remind you to follow minimum health standards, whether you are vaccinated or not, and until we can achieve our target herd immunity, please wear your face masks and shields, practice frequent hand hygiene, and social distancing. We care about you, so please care for yourself. Stay safe, everyone. Bye-bye.